Q22a asks students to outline the impacts of emerging new treatments and technologies on healthcare in Australia. Outline meaning the main features, so it indicates the main features. So what are the main features of the emerging new treatments and technologies on healthcare in Australia? If we go and have a look at our syllabus, what you'll notice here is that healthcare in Australia, if we go a bit further down, you'll see down here it actually says the impact of emerging new treatments and technologies on healthcare, example, cost and access, benefits of early detection. There's the dot point that the question relates to. If we go and have a look and see what we actually gave you, again, you'll notice question 22a, healthcare in Australia, the impact of emerging new treatments and technologies on healthcare, example, cost and access, benefits of early detection. Just refer back to our syllabus. We've taken out 1, 2, 3, 4 of them, plus the one on health insurance across the bottom. So we've taken out 5 of the syllabus points, and we've left in the one that was going to relate to what you need to talk about. So for students who were coming in to do this exam again, they knew that they were getting a question on healthcare in Australia for 4 marks, looking at the impact of emerging new treatments and technologies on healthcare, in particular looking at the cost and access and the benefits of early detection. So those 3 things there, cost, access, and benefits of early detection, were the 3 key things that I was looking for in this answer. Pretty much because we've given them to you already. You didn't have to worry about all of these, just purely from the syllabus, the 1 point there. We go and have a look at the answer that we've come up with here. So outline the impact of emerging new treatments and technologies on healthcare in Australia. The person's gone through this, student. So we're looking at cost, we're looking at access, we're looking at early detection, and we need to sort of come in with some examples as well to support what we're trying to say. Straight away when I start to look at these things here, we've got a bit of underlining. Concern for me is that it looks like every second or third word's been underlined, takes away from the effect. So that sort of needs to be maybe addressed in future exams. We've got the cost, talks about new technologies, and then we've got some, 2 programs that have had some impact would be cancer screening and vaccination, so some examples are very good here. It also talks about early detection, preventative if it's been early detected. Again, relate examples, again being breast cancer screening, the national bowel screening, talking about if people get tests or screenings done at an earlier age or an earlier time, detection of some of these more prominent cancers is a way of preventing them from becoming too serious. So we're already starting to talk about the areas that are required here. And we go down through, we have a further look at the answer. And again, it's just talks about access. Women are encouraged to get breast screening for free. So access, everybody can get them. And men who have been invited to get bowel cancer screenings also do not have to pay. Goes through the child immunisation program where the government covers the cost of children being vaccinated to protect measles and whooping cough. The aim for this program is also to decrease mortality and morbidity. So some terminology from the course has been included in there. And then it just sort of finishes off by saying the emerging treatments and new technologies have allowed for diseases to be treated earlier. So it just goes through and covers the points of this, the areas of the syllabus that we've required, talks about the impact that they're having. Early detection, some of the costs. They're putting the costs up a little bit higher. Are people able to access them? They're the areas that we're looking for in the answer. Some underlining and with some examples. I like the fact that the person's written their examples up the top here. Some bowel and some cervical to look at some things that could relate to their answer. But overall, a very good answer, well set out. Only impact would be probably a little bit too much underlining. Let's just keep it for the real key parts of our answer. Some of the concerns I had with this question was that people were going through and were talking about complementary approaches and medicines. Again, I don't know why that was being included in because we've already seen the dot point that it would come from. Unable to talk about the cost, the access and the early detection and the impact that they would have. So that was another concern for people. Unable to really answer the question. People were very, very general, very basic in the information that was given for this answer. If they didn't talk about the cost, the access and early detection, remembering that we actually gave it to you here in the points that we put on perma line for you to see before the exam. So I expect the students to do a lot better in this. A very simple, in my opinion, very simple, easy 4-mark question, if answered correctly. Students were unable to really get the full marks for this question that they really should have been getting. Again, based on the amount of preparation or study they've done for the exam. So that's question 22a.